I do not want to die, but I am dying, and I want to die on my own terms. Brittany Maynard, a 29-year-old woman from California, was diagnosed with an aggressive type of brain cancer. After radiation and another scan, doctors gave her about 6 months to live. Maynard and her family realized that the treatment the doctors would prescribe would barely keep her alive, and her status of life would be below livable. After careful thinking and consideration, Maynard accepted her ultimate fate and wanted to die on her own terms. Suicide by legal assistance is a practice where doctors prescribe a lethal substance, ultimately killing the patient with the terminal disease. The legality of euthanization would reinforce individual autonomy, giving patients a safe, thorough medical practice to end his or her own life. In terminal cases, usually the anticipation of dying torments patients up until one's last moment. In many cases, a patient does not want his or her life taken by the dreadful disease at any given time or place. Patients often consider legal euthanization to ensure individual autonomy. Each individual person has a right to his or her own body. Author Thomas Frost says the right to bodily autonomy has been interpreted in Article 8, the right of privacy, of the European Convention on Human Rights and the Human Rights Act. Article 8 demonstrates a legal right that one has for his or her own body, therefore, legal euthanization should be an option if wished. A secondary reason why bodily autonomy would be established is because a person would be able to control who would be there, when, and where he or she would want to die. Nurse practitioner Anna Dykes states, physician-assisted suicide upholds patient autonomy by allowing the patient to die on their own terms, deciding who is present, where, and when their death will take place, ending the process of painful and undignified lingering. The fear of death is common in the general population, and most patients feel vulnerable realizing he or she cannot control his or her demise. With the comfort that a patient leaves this earth knowing he or she has made the decision, it also reassures loved ones that the person is not in pain anymore. Not exclusively would assisted suicide reinforce individual autonomy, it is also a safe medical practice that seems more humane than other treatments. To be able to administer this medication, the doctor has to have the correct licensure and pre-certifications that are required. Specifically in California, it is stated that the attending physician must be licensed in the same state as the patient and have a current United States Drug Enforcement Administration certificate. Doctors being certified by government agencies confirm that assisted suicide is a safe practice that a patient should be able to trust. Likely, every state has different laws that have requirements for a patient's death. For example, in Oregon, a patient must be 18 years of age or older, capable of making and communicating healthcare decisions for him or herself, and diagnosed with a terminal illness that will lead to death within 6 months. In addition, a number of mental health screening assessments are available for physicians to use in the office. Doctors make sure that the patient is able to comprehend the causes and effects of taking the lethal medication and confirm that one is competent enough physically and psychologically. On the contrary, some experts conclude that euthanization should not be legal. Many doctors are not confident in themselves to give a patient a certain prognosis of the disease. It is stated that 27% of Oregon MDs who are willing to write lethal prescription admit they are not confident of the 6 month prognosis. In addition, doctors could abuse his or her power and prescribe strong controlled substances to the public, not knowing where the medication could resurface if not taken by the patient. For example, doctors who use these drugs to assist suicide are subject to having their federal narcotics licenses suspended or revoked. Ultimately, it is the patient's decision whether or not he or she wants to take this lethal medicine. The doctor can prescribe the medication, however, the patient is not required to ingest it. To conclude, legal euthanization should be legal in the view of the fact that not only would it reinforce bodily and individual autonomy, but is a safe medical practice. Terminal diseases are misery for the patient and his or her family too. With the legalization of euthanization, patients would be spared the pain and anxiety in the forthcoming days or weeks of his or her death and comfort family members as well. In the United States, only 10 have legalized euthanization, and it is discriminatory that not all patients have the same opportunity as others. Voluntary euthanization should be legal for patients, doctors, families, and the general population alike.